So I have the distinct honor of introducing our keynote speaker at this time, and it is truly a privilege. I think this will be the last time that I get to introduce Karen for an ONC annual meeting. And so I just want to personally thank her for her service to our country, everything she's done for us. I know that she'll be here a while, but I don't think we'll have another annual meeting before the transition of administration. So it is my pleasure to introduce our keynote speaker, Dr. Karen DeSalvo. Dr. DeSalvo was appointed as the National Coordinator for Health Information Technology at ONC in December 2013 after serving as Health Commissioner for the City of New Orleans and Senior Health Policy Advisor to New Orleans Mayor Mitchell Landrieu from 2011 through 2014. While there, she transformed the outmoded health department to one that has since achieved national accreditation and restored health care to devastated areas of the city, including leading the establishment of a public hospital. In May 2015, President Obama nominated Dr. DeSalvo to serve as the Acting Assistant Secretary for Health in the U.S. Department of Health and Human Services, a role in which she concurrently serves. As the Acting Assistant Secretary for Health, Dr. DeSalvo is charged with developing policy recommendations as they pertain to public health issues that cut across HHS agencies and operating divisions. As a physician, Dr. DeSalvo has focused her career toward improving access to affordable, high-quality care for all people, especially vulnerable populations, and promoting overall health. It is an honor to serve alongside her at ONC, and I'd like to add, and to work for her, where she is leading the charge to set high-level policy in the strategic direction of health IT across the nation. Without further ado, I would like to welcome to the stage someone who truly exemplifies the theme of this year's meeting, committed to better health through IT, Dr. Karen DeSalvo.
Thank you so much. Thank you so much.
How's everybody doing? Good. Let me hear a little louder. I'm gonna have to rowdy up the crowd for our last visitor, former Secretary Sebelius. It's really wonderful to be here today with all of you and with so many of the team. A special welcome to those who are watching via webcast. We have 750 people who are watching online. Can you believe that? It's nice to see a lot of familiar faces and some new faces, so thank you all for being a part of this, not only work today, but of our journey in health IT. I do want to take a minute to acknowledge some of the ONC grantees who are in the audience today. I'm going to start with some of the former grantees. This is the part where I do the public health and you guys get to stand up. So can I have the REC former grantees stand up because of all the work you've done to see that we have been able to move so rapidly towards adoption. Stand up for me if there's any of y'all in the audience. There we go. Thank you. And Beacon grantees, former Beacon grantees. I saw Kendrick in the hall, but HIEs. And then we have some oldies and some new. So we have folks who are part of our new grants that we announced last year for workforce development. They're in the process of training 6,000 new folks into the health IT world, and they build upon the work of our prior workforce grantees. So if any of those folks are in the room, would you please stand and be recognized? And we had an additional grant that we announced last year, which was a funding opportunity to build upon our health information exchange work to try to bring in new sources of data, new types of providers, whether they were from EMS or social services or behavioral health. And so those community grantees went through a very competitive process, and some of them are in the room today too. So if I could get you to stand up and be recognized. And my last big thank you is really to the folks from the Hill, some of whom were here today, and you saw a couple of videos earlier from Senator Alexander and Senator Murray, and tomorrow you'll see one from Representative Hurd. These folks on the Hill have just been terrific partners, especially in the last year and a half, 2 years, at really helping us think about how we build upon the strong foundation of health IT to a brighter future, really, for everyone. This meeting is one that I always look forward to because of it's a chance to see so many old friends. Some of you may not know I was a grantee of ONC, so I used to be the one that got to stand up, and so I like to make sure I recognize what it's like to work out there in the field, because I do know that this work is tough, and we're changing not only technology, but we're changing culture. This is a chance for us to bring you all together in one place and see that you can learn from each other, especially throughout the day tomorrow, but also learn from the people we're most here to serve, the consumers, on the third day of our event. I mean, we have really been doing a tremendous amount of work in a short period of time at a very dizzying pace to see that we can not only digitize the care experience and now the health experience of every American, but that we're reaching a place where that data is going to be available when and where it matters most. We've seen some of the progress in the data just with EHR adoption, and I think it's worth taking a moment just to look at this from the brief that we put out today, which comes from the American Hospital Association data. They are great partners in helping us keep track of the progress the country is making. You know, when ONC was started in 2004 by then President Bush and David Brailer took the helm, the charge was to see that every American would have access to their electronic health information, and this has been carried forward by President Obama in this administration and with the passage of the HITECH Act in 2009. And we have been steadily working, all of you out there watching, on seeing that we can have a digital record of the care experience of people in this country. And I think it's just so important for us to take a moment to recognize that we have made significant advancements in one of the original goals that we laid out. They wrote in my remarks that they wanted me to tell a personal story right now, and I don't know what Vendel ended up doing today. So I'm going to go way back before 2008 and tell you guys that when I was training at Charity Hospital as a medical student in the early 90s, one of my jobs as a med student was to go up to the lab floor and go to a place where there was a set of wooden boxes and pull out the labs for the patients for the day. And they were written on carbon copies, little piece of paper. This was the potassium for the patient, and then we would scribe that into the chart and then present it on up the line. And that process of pulling labs out of a wooden box happened in my professional career as a medical student in the 1990s in the United States of America, thank you. And if you just think about where we are today, that some of you all might be right now checking your patient's labs on your smartphone to see what the results came back. This is a tremendous opportunity clinically for those of us who've been practicing, but it's also coming with a lot of unexpected challenges and unexpected opportunities that you've heard about. This adoption rate, where it's 9 times the rate that we were just in 2008, is really just the beginning of this journey that we're taking. As a doctor, as a daughter, as a policymaker, I just know that what we really need is to see that actionable, usable electronic health information is available when and where it matters to consumers, where it matters to all of us who are users of that data. And it's coming from so many sources today, even compared to where it was in 2008 when we started measuring. It's much more than the electronic health record. It's wearables, it's the Internet of Things, it's social services, it's biking data, it's community level information. And our chapter ahead is how to bring that information together to make it usable and actionable for everybody who wants it. This is what I hear loudly and clearly everywhere I go, in every community where I have a listening session or visit a clinic or visit a health center or a hospital or a scientific environment or a public health agency or any place that we go, we hear that what people want, what the people of this country are ready for, is their electronic health information to be available when and where it matters to them. They're impatient with the progress, though they're thankful for it, and they want to know that that data is going to be free. Thank you, John White. It's also something that we're hearing increasingly from scientists, and you heard it on the panel today about the use of it for precision medicine or the cancer moonshot or comparative effectiveness research. And we've heard it very clearly and articulately from the president and the vice president about their sense that the time is now for us to build upon the success of adoption that we have already seen. The Office of the National Coordinator firmly believes that this is a process moving forward that's going to require the partnership with the private sector and all of our federal partners. We have taken an approach these last 2.5 years that is about public-private partnership, a shared vision and strategy ahead. We laid that out particularly around interoperability in the nationwide interoperability roadmap and took that opportunity to say what we would do by when and where we thought the private sector and states could also weigh in. I really want to thank publicly everyone, including our federal partners, the states, the private sectors, and individuals who have really stepped forward to meet those expectations, whether it's working on patient identification or new technology that can create apps or maturing FHIR. It is all of us together working to advance that vision and those goals that are going to get us to the kind of learning health system that we're all dreaming of. The way that we've been really boiling down boiling down the way we're thinking of moving forward, I think Dr. Washington shared this with you all this morning. This is what we're calling around the farm the 3 C's. This is common standards, culture change, and a business case for data to move. As we think about the work we've laid out, whether it's high level like our federal health IT strategic plan or more concrete, such as in the roadmap, and understand how we need to move forward on what key critical path issues, and take in everything that we've heard from the field, from people who are doing this every day. We think that these 3 areas capture most of the most important work, the most impactful work that we need to be doing every day at ONC. And so just as we're thinking of celebrating the success of adoption and that trajectory of the line going up of health information exchange year over year over year, we also see in the data that there are challenges in some areas like integration of data. We know that we still have so much work to do as an ecosystem to have data that itself is interoperable, not just systems that are interoperable. We want to move to a place where we're working off of the same language so that there's not the added work and expense and sometimes frustration of not having federally recognized national standards that are the floor, but also creating opportunities to really advance new kinds of standards that can advance the field. This first area includes, really importantly for us, the notions around privacy and security and cybersecurity of data. And we want to make sure that the kinds of standards that we lay out as the federal part of this resonate with you all and are reaching every corner of this country so people understand expectations around privacy and security. Which blends easily into the next, which is about just changing the culture of data sharing in this country, where for too long, and I think still today, we think about data as something that we have to hold tightly onto. It's built into our DNA of medicine that we want to hold data, and we're worried about exposing it because we don't want to violate HIPAA or have challenges around privacy. Consumers are expecting that we're sharing their data on their behalf, and HIPAA allows it. And that is why we have spent so much energy with the Office of Civil Rights to see that we can provide more clarity about what HIPAA is and what HIPAA is not just for providers, but for the folks working in compliance, as well as for consumers. The work that we're going to keep doing is to make sure that we're lifting up that message so that we can really get people to understand that data should flow by default, yes, securely and privately, but needs to do so on behalf of the consumers. And finally, we have been hearing very clearly that there needs to be a better case for sharing data. We've spent very much of this effort on creating a payment case in the healthcare environment. But you heard earlier today about researchers who are creating an additional business case for data sharing, one in which we can all see the acceleration of science, a revolution on the forefront. And that is an additional way that I think we're all going to be able to help data not only get pushed, but also to get pulled. We asked a few months ago for many in the field to work with us on addressing these drivers of success, to do it in a way that it wouldn't just be the federal partners, that it would be a public-private partnership. And as part of that, we asked for people to take a pledge publicly about 3 broad commitments. The first would be that we would all agree consumers should have access to their electronic health information and that it should be available when and where it matters to them. Secondly, we agreed that we would not engage in health information blocking that was unreasonable. And third, we agreed that we would move to federally recognized national standards, including those around privacy and security. And you heard a lot of examples today from many of those partners who are following through on those commitments in ways that they're bringing them to life to see that consumers have information, it's flowing appropriately, and that we're moving to a set of standards that are going to enable a more seamless flow of data, one that's going to bring us to a learning health system, an open, connected community of health. We've certainly been working to continue to do our part on that end, And we believe that one of the ways that we can continue to advance on those commitments is to keep pushing for more market transparency. And that's why today, one of the things that we want to make sure you're aware of is tomorrow we're going to be posting on a website, healthit.gov/transparency, a detailed listing of easier to understand information about certified health IT. It'll be on this website what we have available now, and we'll continue to update this going forward. This is a way to put plain language information out there for providers who are looking to purchase health IT. I have had to do this several times in the swing of purchasing health IT, and some of the language can be confusing, especially if you're in a smaller practice and if you don't have an REC nearby to help you out. We want to see that this is a way that we can really make sure that folks know what they're purchasing, know what they're not, and create a better platform for a more transparent marketplace. We've also asked for many of the developers and vendors to voluntarily attest to even more than that, to say that what actions they're going to take to really support more transparency. And essentially all of the folks who came forward with those initial commitments about consumer access and no blocking and federally recognized standards have also been moving forward to voluntarily be more transparent on the website. So I do hope that you guys will take a look and give us some feedback and ways that we can continue to improve it. All of these efforts, whether it's we're creating roadmaps with you or we're setting clear guideposts through our rulemaking process, working with our federal partners to set a clear business case for advancing interoperability and improving health IT, whether it's we're setting out challenge grants so that health information can be more like a tap away on smartphones for providers and consumers and others, are ways that we're trying to advance this marketplace in collaboration with you. And we know that we cannot, we should not, and we will not do this alone. This requires strong, continued partnership from those who are already invested. It requires making the tent big enough for consumers, now for more investigators and researchers who want to be a part of this new journey, as well as entrepreneurs that when they can access that data are going to show us ways that we're going to improve the health of this country in ways that we haven't even begun to imagine. So thank you all for the work you've done to get us so successfully to this place. Thank you for what you're doing right now to see that we're really advancing data exchange, data interoperability, and the uses of that data for so many of the great purposes that you learned about today and that you're doing on the front lines every day. And thanks for being with us this week as we roll up our sleeves, especially tomorrow, and think about the actual how, not the what, and then close it off with the who, which is the consumer, because that's who we're all here to serve.